Next, we'll have Dr. Peter McCulloch is an internationally recognized authority on the evaluation of medical evidence concerning contemporary issues in medicine, and is published widely. Since the outset of the pandemic, Dr. McCulloch has been a leader in the medical response to COVID-19 disaster. He has dozens of peer-reviewed publications on the infection, has extensively commented on the medical response to the COVID-19 crisis. I don't think there's been a doctor who's been more persecuted. Just tragically, it's outrageous what they've done to Dr. McCulloch. As an example, they've used Dr. McCulloch and others as an example to control the rest of the medical establishment and create a level of fear that's justified because of what they've done to Dr. McCulloch. Now, I've given you like 10 minutes, and I've asked Dr. McCulloch to lead the discussion, opened up a little bit with Dr. Cole talking about could the vaccine possibly have driven the variants, natural immunity, and asymptomatic spread. So Dr. McCulloch.
Thank you, Senator. Can I ask Liz if you change positions with Paul Alexander? We're going to have Paul step in for this. Thank you very much. I'm trained as an internist, a cardiologist, and an epidemiologist, and I have been completely focused on this crisis since the outset. And when I testified here in the U.S. Senate, November 19th, of 2020. We had just heard about the COVID-19 vaccines by press release, and myself, Dr. Risch, and Dr. Freed were asked by Senator Johnson, do we have any comments on the vaccine? The answer is no. We had no comments because the vaccine results were presented by press release. And we held back and carefully looked at the data. America had 250,000 deaths due to COVID-19 before the vaccines. Now, our CDC says that 10% of those deaths are due to adjudicated COVID-19 pneumonia and its consequences, and that 90% are in fact the infection, but there are contributors. There are other medical problems, 2, 3, or 4 medical problems. Being elderly, as Dr. Risch points out, obesity, diabetes, heart and lung disease, kidney disease, frailty. So we knew when we were dealing with the first waves of the outbreak, the original Wuhan strain, the ancestral strain, and then our very first big variant wave, Alpha, that came through before the vaccines were exposed in our population, before they were introduced. We knew what we were dealing with at that time, and as Dr. Merrick and Corey pointed out, early treatment was being advanced, and that was the news that America needed to hear, that we could treat patients and get them through the pandemic. A survey was completed and published this year by Vertkirk and colleagues showing the only Americans who are hospitalized and died were those who received no treatment. Almost 201. Even if someone had received early treatment and they were hospitalized, they were going to survive because they had enough pre-hospital treatment. But since the vaccines have been introduced, we've still been keeping track of hospitalizations and deaths. And we now, since mass vaccination has started, we have amassed 750,000 deaths plus in the United States. And the hospitalizations run 10 to 1. Now, fortunately, the virus has mutated and has become far less invasive, far less deadly. And we know now today that people are getting second and third infections. And to each person, the second and third and fourth infections become progressively more mild. And that's good news. But my question is for Dr. Alexander, who has spent his whole life studying evidence-based medicine and epidemiology and epidemiologic phenomenon. Is mass vaccination making this worse? Is it driving variants?
Well, Dr. McCulloch, first of all, thanks to Senator Johnson and the Senate, etc., for us here and the company that I'm in. I follow Dr. Risch, Dr. Corey, Dr. Marek, etc., and it's tremendous to have this chance. So the reality is that we have studies right now by Subramanian, Kempf, BD, etc., that shows us that the countries in the world that mass vaccinated across all age groups very rapidly, and that's the key, the rapid mass vaccination. Those are the nations that have shown us now elevated infections, cases, hospitalizations, ICU, and death. And the data now is very stable and clear that something has happened with these particular gene injections. Some call them vaccines. We continue to call them gene injections. That when you vaccinate a population, you're trying to stimulate adaptive immunity. And that means neutralizing antibodies that will eliminate the virus. So you want to stop infection, you want to stop replication, you want to stop transmission. But rapidly we go to see negative efficacy with these Pfizer and Moderna vaccines particularly, where we are seeing that those who are vaccinated are becoming infected and reinfected repeatedly. So much so that when you use these vaccines now, they are placing the pathogen, and as Dr. Cole said earlier, we are at BA4, BA5 subvariant clades. When you place these variants under pressure, natural selection will operate and will select for more infectious variants. So much so that if you kept this bivalent program going, the new booster, you are going to keep this pandemic going for many, many more years. In other words, this vaccine rollout, the way it has been done and the way it is continuing, will keep in variants emerging, one variant after the next, and they're going to be more infectious, and there is a concern among virologists that it could become more potential, lethal and virulent. So yes, I have no question when you look at the data that the vaccination program, the mass vaccination into a pandemic, whilst there's tremendous infectious pressure, you see, that is the issue that those who have conducted this vaccination program have made a catastrophic mistake. You do not load your weapon whilst the enemy is on the battlefield. You vaccinate outside of season. We have vaccinated while this virus is circulating. These vaccines cannot work, will not work. They will fail and are failing.
So let me quick ask a question. I've put up behind me a chart that I prepared in, I think, September, October of 2021. This is when the president was coming out saying this is a pandemic of the unvaxxed. When we were still getting information from Public Health England showing that 63% of their Delta deaths, which was the main variant back then, were from fully vaxxed individuals. But I created this chart, which the blue bars are the number of new cases.
Yes.
And so you can see the pandemic, rise toward the tail end of 2020, peak early 2021, then start falling.
Yes.
So kind of coincidentally with the rollout of the vaccine. Now, again, I'm not an epidemiologist, but I'm asking the epidemiologist. I would expect that with or without the vaccine, it was kind of looking like this pandemic was burning itself out. And certainly if the vaccines would have worked, wouldn't have we assumed that you would have just had a gradual decline into extinction
Yes.
of the pandemic? But that's not what happened.
Yeah.
So, Senator, in December 10th, 2021, the CDC reported to America that big outbreak, the Omicron outbreak that was occurring right into mass vaccination. 79% of people with Omicron were fully vaccinated.
Yeah. And then I'll close by saying, you can only tame a pandemic. You can only get to the end if you get to population herd immunity, but you must cut the chain of transmission. And your graph was the seminal graph to us, because if you look at it, if you look at the downslope, had we not mass vaccinated, it is highly probable that we'd have gotten the population herd immunity across the United States, and that vaccine caused a catastrophic problem right there.